Hello, my Pilonidal people. um, my name is AJ. Welcome to my living room. Today I had a pilonidal cystectomy surgery with a Bascom type 2 flap. So let me get that out of the way. Um, Today is day one, and I thought it was important that I share information about my experience with pilonidal disease, my decision to have surgery, what that surgical experience looked like, and my recovery. Like I Googled images and that was a mistake. I looked at Reddit, I looked at a bunch of different websites trying to find information, YouTube videos. I wasn't really able to find what I was looking for. And so I thought, okay, I need to post a video to let people know not all these cases are extreme. So that's the purpose of this video. So let's start off with my history. So I've had pilonidal disease for about 3 years. I had 3 flare-ups and they were all mild to moderate. Your experience might be different. You might have a more severe case, and so your discussions with your medical team may be different. For me, about 3 years ago, I had my first flare-up. It was over the weekend. I went to urgent care because it felt pretty raw. The tailbone area was red, and I had a little bump that was not large at all. It was smaller than a pencil eraser. And I wanted to have it checked out. I wanted to know, what is it? They immediately diagnosed it as pilonidal cyst. They gave me an antibiotic for, I think, 7 days. I took that and it resolved. It felt great. They also told me, if it comes back, you may need surgery. And I thought to myself, oh, that's odd. It's not even that painful. It doesn't really cause a lot of trouble. That sounds over the top. And so I just, discounted that as just excessive. A year later, I had my second flare-up. It was less painful than the first. It resolved on its own within 2 or 3 days. And so there's not much to say about that one. It just felt like I had sat down too long. My third flare-up was 3 or 4 weeks ago. That one was the most painful. It was still mild to moderate, so it wasn't extreme. I think I had 2 pits. So, looking back there with the mirror, feeling around, it looked like there were 2 small pits. The overall area was red for about 2.5, maybe 3 inches at most. And, because I had this in the past, I knew what it was, and I knew I needed to get an antibiotic to fix it. So I went to urgent care again. It was over the weekend, and they gave me an antibiotic. I felt really good within the first 24 hours. I took the whole 7-day, may have been 10-day, not sure. Take all your antibiotics, do what your doctor says, and felt great. Scheduled an appointment with a colon and rectal surgeon. I had met with this surgeon in the past for a separate issue. It was outstanding, and so I felt really confident in him. My surgery was performed by Dr. Harry Kahn. He's with the Evergreen Health Network in Kirkland, Washington. This is a fairly common procedure, so just find somebody that you're comfortable with and who has performed it in the past. Let's talk about the procedure. Let's talk about what that looked like. So a bunch of options were presented to me, and I decided on the Bascom flap type 2 procedure. So this is a twist on the original Bascom procedure. So what I want to point out here is that my case is different than others that I've seen online. It's possibly because I had mild to borderline moderate pilonidal disease, and I'm having the surgery, I would say, in the early stage of knowing that I had the cyst. I'm not waiting around 10 years or anything like that. So your case might be different. Um, if you're tackling this on early, then stay tuned, because this is more likely to align with what you're going through. So here's what you need to know about this procedure, and at least my experience from it. I do not have a drain after the procedure. I do not have sutures. I have this type of surgical tape that they use for breast augmentations and for breast cancer surgeries, and it acts as a literally like a piece of tape that holds the skin together to heal. There may be sutures inside. I'm not sure. I don't know why I didn't ask, but I don't feel any. There are no external sutures, so I don't have a lot of pain. My pain right now is a 2.5 out of 10. It's very minimal. So you've probably heard stories of people who are just in so much pain. They're not happy. They're not comfortable. I'm here to tell you that my experience, that's not the case. So the procedure that I had, it was not an issue. Tomorrow might be different. Maybe some numbing medicine's going to wear off overnight, and it might change. And follow along. I'll document that and let you know what it's like throughout the next few days. But right now I'm very comfortable. So here's the process. So I went ahead, scheduled the procedure. Follow the instructions that they give you. You're under general anesthesia for this, so no eating or drinking after a certain period of time, and just make sure that you follow all their guidance and recommendations. This morning was the procedure. I arrived at around 8:30 in the morning. I checked in with the reception, hung out for a little bit, and then I was greeted by a nurse. So we go back. They do blood pressure. They do all the vitals. We also did a COVID test because it's 2022, so COVID is still around. So we did that. After the nurse had put an IV in my hand, I've had this done before when I had my gallbladder out, and it was a bit painful. Not exceptionally painful, but just, it was a little irritated. This time around, barely noticed that it was there. It felt fine. It was not uncomfortable. We go ahead, and after that, change into surgical gowns. You also cleanse your body with, I think it's Hibiclens on a wipe. So it's almost like a Clorox wipe for your body to disinfect and make sure that you're ready for surgery. So it took care of that. After, I see the anesthesiologist. The guy goes through an entire medical history and spends a good amount of time talking with me about, what I've had done, procedures I've had done in the past, my experience with general anesthesia, and I felt very confident with him. So it was a great experience. He shared with me how he was going to put me under, how he was going to help me stay calm up to the procedure until the point that I went under, and what to expect when I come out. So he had mentioned, because it's under general anesthesia, he's going to do an intubation. So my throat is a little sore. It's actually, this pain from the soreness is maybe 3 out of 10. The pain from the actual procedure is the 2.5. So it's really not painful at all. I feel great right now. So it's been it's been about 5 hours since I had surgery, and I'm feeling outstanding. Let's see. So after anesthesia, I met with the surgeon. We went through, the process, what to expect, talked about recovery timeline, talked about the ability to get the wound wet, shower, go about your day. Obviously, you want to be smart. Don't do silly things like weightlifting or anything like that. But today's Wednesday. I took off today through Friday from work, and I told work, I'm like, I think I might be okay to come back Monday, and right now I think I will. I'll probably have a light day. I'll probably take it easy, but the work that I do is remote, so I could work here at home on my laptop, and it is sitting down. And right now, I think I'll be able to do that. So that might change, and I've already given them a heads up. They're very accommodating, and that's, very lucky for that. But I don't expect to have much pain or discomfort, at least how I feel in this moment. So that is subject to change, and we'll see. But right now I feel great. So let's see. After a meeting with the surgeon, nurse from the OR comes in and takes me to the operating room. They have a great setup. I had a hemorrhoidectomy in the past, and that was brutal. That was not a fun experience. They have you get ready by getting you into position, so it's just in a very embarrassing position. Here in this procedure, at least at Evergreen Hospital Network in Washington, it was very comforting. First of all, they had these warming blankets on the OR table, and that was just an unexpected experience. It was almost like a luxury. It was just calming, and it felt great. And so it wasn't a cold table. It was just nice and warm, but not hot. It was just comforting. And what they did was they put me under while I was lying down on my back. And I didn't have to get into an awkward position. I didn't have to expose myself to, I think there were 7 people in the room. So yeah, I didn't have to do anything like that. After they had put me under, then that's when they rolled me over onto another bed, and then, well, I assume that's what they did. They got me into position, basically, and they did their thing for an hour. So I woke up in the post-operative recovery room, and I woke up a bit groggy. It took me a few minutes to open my eyes and adjust to the light, but I didn't feel nauseous. I didn't feel uncomfortable. The post-op nurse was incredible. I was a little bit out of it. In fact, she asked me, do you like graham crackers? And I guess I was out of it, and I'm like, I love graham crackers. So ate some graham crackers, had some juice, and woke up. Felt really comfortable. Checking vitals the whole time, making sure that you're doing well, that you're comfortable. After that, I had gone into another room with like a separate discharge nurse. So it's a separate room, and we went over discharge instructions and had some more stuff to eat, and waited for the discharge to take place. And it wasn't long. They never rushed the process. It was great. It was all thorough, and every section of the process was private. So you had your own private suite in the beginning. I call it a suite because it wasn't like a doctor's office where you were waiting in pre-op. that first stage, right? So you're in the waiting room, and then they call you into that first room, and it had it had a love seat, it had a club chair, a dresser. I was given a garment bag to put all of my stuff in and change, and it was pretty professional. I was definitely surprised. So it was a great experience overall. I left the facility. Car ride home, sitting was fine. So I didn't feel uncomfortable. Stopped at the pharmacy, picked up 4 medicines. So I'm looking at them right now. One is an antibiotic. Very important that you take that. The other is oxycodone. I took 1 pill, and I don't expect to take any more. I feel fine. I took the first one out of an abundance of caution, just in case I started to feel pain as the numbness wore off, but I don't think I need that anymore. The remaining 2 medicines, one is a stool softener. So take that, it'll make your BMs happy. The other one is anti-nausea medicine. I didn't take that, didn't need to. So that's what I've got. I also have some non-stick gauze. I was told that there may be some discharge, and so it's normal and expected. And so I have some non-stick gauze in case I need to use that. Right now, feel great. Came home and I had a smoothie for breakfast/lunch. So they said to start off with something cold or cool. They used the word cool, and to avoid heavy meals. So I thought, okay, a fruit smoothie is really gonna just pump me up with the vitamins that I need. So there's a smoothie place nearby, and I got a large smoothie. It was strawberry, banana, pineapple. There may have been mango in there, coconut, and I had them add fiber because it's important. After surgery, people tend to get constipated, so fiber is important. So they added a fiber booster in there, and I also put in some peanut butter. It's delicious. So natural foods are your friend right now. That's where I am right now. So I feel great. Some other people have had different surgeries where they feel not so great. So ask your surgeon if this is an option for you. For me, right now, I could not feel better, given everything that's happened. I'm just curled up on the couch right now, hanging out, not in pain. If I want to, I could walk around. I'm walking around, a little bit. I'm not going to go for my outdoor walk today. That's not happening. But I could sit, and I feel comfortable. So day 1, looking pretty good. My next video will be tomorrow, and it will cover the overnight. If I had, any issues, or basically what my experience was for overnight, and then how the day after surgery feels. So I'm looking forward to that, and I think we should be in a good spot. So if you have comments, questions, please post them. I'll be happy to answer them. And I look forward to that. So again, I didn't see a lot of videos online. I wanted to post this so that I could be available as a resource, that I could share my experience and my information. Your case is going to be different, right? Because we're all individuals. And so just check with your team to find out, what's best for you. But I'm gonna share my experience because I've seen some nasty ones out there, and I want you to know that they're not all bad. So, thank you.